right now because there is no bill really. There's 4 different bills floating around the House, 4 different committees are each working on different sections of the federal bill. The Senate has no bill to look at right now. The Obama administration is talking about guiding principles, which is a good thing to talk about guiding principles. That's what you need to do. But if you look at the major proposals of the federal plan, they break down into these areas. The public co-op option, so a public plan, the government offering actual health care insurance plan you could purchase, which is essentially the same idea as the co-op. Those two things can work together. Maybe it is, maybe it's not. But you can treat them as very similar ideas right now. The individual mandate, saying everybody in America must purchase insurance, is being kicked around in those bills. Interesting, the insurance companies love the individual mandate, right? They hate the government option, love individual mandate, obviously. Employer mandate. Walmart supports the employer mandate. Very interesting. NFIB, National Federation of Independent Business, is adamantly against the employer mandate. So go figure out those two things, work together, look at what Walmart's up to, what NFIB is up to understand the employer mandate. Now, one of the scarier ones is the mandated benefit package. This is the federal government coming in and saying that all 50 states will have the same mandates in all their insurance plans. Not the case right now. Obviously, different states have different level of mandates. Health insurance exchange, which actually is a conservative idea that came from a conservative think tank back in Washington, D.C. To be able to have exchange, their idea was to do it through the private sector, and there are currently private sector exchanges in existence in the country. This would be for a federally operated exchange. Premium subsidies to people making up to 400% of poverty, which comes out to be somewhere around $90,000 a year for a family of 4, and then Medicaid expansion. So if you look at these major ideas of the Obama plan, or the plans in D.C., not necessarily the Obama plan, what you find is three key questions have to be asked. Cost, choice, and quality when it comes to what's being talked about in the federal level. First, when it comes to cost. Under the federal plan, costs will go up. And the reason I say that, all of the major drivers that we just looked at in terms of plans for the Obama plan are cost drivers. They aren't cost savers. Mandates will increase costs. Subsidies will increase costs. The government option, at the end of the day, will increase costs, and I'll go over how that happened in Washington State in a second. Mandates increase the cost, and you'll see the public option, either tax increase, or you'll have to see other types of ways to do the premium subsidies under that plan. Perhaps a more troubling aspect of the federal plan is choices. Now, I know it's a little small to read up here. It's actually a quote from the Puget Sound Business Journal. And it talks about in 1993, when the Washington State Legislature passed health care reform, we went from having 18 providers to 3 providers in Washington State for health care insurance. 18 providers to 3 providers. You lost your choice. They're basically regulated out of existence. That's from the mandates. If you look at the federal plan, the 8 things we just went over, most of those things were also included in some level or some form in the 1993 Washington State Health Care Reform Act. You lost your choices. 1999, the individual market crashed because of the mandates and the rules that were placed in there. And there are many places, 30 out of the 39 counties in Washington State, you couldn't purchase insurance in 1999. If you wanted to go buy insurance in 1999, you could not do it because nobody was offering insurance because of the way the system was changed. Limits your choice significantly. The other big concern is health savings accounts, a viable option for 8 million Americans right now, growing in size every year significantly, also called consumer-driven health care plans. Under the federal plans that we've seen so far, again, we're speculating if you haven't seen the final bill, HSAs would be significantly limited or eliminated under what's happening in the federal mandates and the federal guidelines. So great concern about what would happen to choice under the federal plan. Quality, I don't know. I don't know how to quantify the quality would be under this federal plan. That would be the details of what they put out there. You know, you can say Switzerland has good quality, Canada has good quality, I think we have the best quality. Hard to say what would happen under the federal plan in terms of quality of care you would receive. You can speculate, look at other government programs. You might be concerned, look at Medicare, Medicaid, the VA, post office. There are concerns out there about the quality you get under the federal plans. Now this stat up here came from Senator Karen Kaiser, and it was a study done by Mathematica Group out of Massachusetts with regard to health care reform in Washington State. And I put this up here for full disclosure because I want to give you the details of what we looked at in Olympia this last year. I know it's a very complicated chart. But the key points. on this particular chart, it lays out different options for healthcare reform, and then it has the number of people covered, the increase, and the total expenditure, the total cost of the state of Washington, right? So this is the regulatory reform one. You change the system, you do small group reform. You see there is you increase the number of insured by 1.2%, and you increase cost by 0.1%. So you don't increase costs, you insure more people. The connectors, the Massachusetts-style plan. The bill that we actually voted on in the Senate, that didn't get out of the House, was proposal number 3. And that's the one I want to focus in on. What that shows is 10.6% increase in the insured, which means all people in Washington State would have insurance under plan number 3. You work your way down and you see total expenditures minus 3.6%. And you think, this is a great idea, right? You can get everybody in the state insured, and you can reduce the total cost of health care by 3.6%. How can you be against that? That's what Senator Kaiser thought. How can you be against that? Well, when you drill a little bit deeper into the proposal, what you see, it is about a 12% payroll tax, but you still spend less overall. But what you don't see on that chart is you lower everybody's benefits to Medicare and Medicaid level of benefits. And so you choke down the benefits to everyone to be able to achieve those savings. And what happens with our doctors, of course, Medicaid pays about 25% less than a private paying insurer right now. So many of our doctors don't want to take Medicaid patients because they're losing money on every one of them. So that's how you see the savings achieved through the mathematical report and the partnership plan, which is basically a single payer state-run system funded through a payroll tax, is you limit access basically to health care through the government. Do you call it rationing? What do you want to call it? I don't know. But that's the way you achieve savings, because if you're going to add a lot of people to the plan, cover everybody, and reduce costs, something has to give at the end of the day. So when we sat down last year and went through our healthcare reform package, these are the guiding principles that we use. Protect what's working. Number 1, don't break it. don't fix it if it's not broken. And look at what's broken and fix that. Sounds simple. In Olympia and in Washington, D.C., sometimes the simple concepts like that get lost people. Fix the safety net for the truly needy. We have, I think, the responsibility to help out the truly needy in our state and our country. Give them assistance. Find ways to make healthcare more affordable, and need assistance beyond that. Work with them to make sure they get the coverage they need. Solutions are not partisan, and all good ideas must be considered. You know, I don't think that a Republican idea is better than a Democrat idea just because it comes from one party or the other. But all ideas need to be put on the table and look and see what actually works and gives the people what they want and what they need. Breaks down government-created barriers. Right now, the government puts up a lot of barriers to healthcare reform. I had a guy call on the radio show this morning, his daughter cut her nose, came to the ER, long line, wanted to go down to a private pay facility and get taken care of. They wouldn't let him pay cash. A government regulation prevented him from simply going in there and paying cash to get the 3 stitches that his daughter needed. Health savings accounts. There are a lot of barriers the government puts up to health savings accounts right now. The inability to purchase health care across state lines is a government barrier that's put in place that prevents you from being able to make decisions. So there are a lot of barriers the government puts in place. And of course, I believe we need to protect the freedom of individuals to make choices and limit government growth. Right now, at the federal level, people would argue you're moving a lot of responsibility to the federal government, you're growing government, and when you grow government, you lose freedoms for individuals to make choices. I believe in protecting their freedoms and trying to limit the size of government. We're getting close to being done here. I'm cooking as fast as I can, believe me. Okay.